Welcome, PGDMLT students. I am absolutely thrilled to have you here for this orientation explainer. You are stepping into a fully online basic hematology and blood banking course, and my main goal today is to set you up for absolute success. We're going to establish a really friendly, professional tone right out of the gate and walk through exactly how you should approach your studies in this digital environment. So, let's get into it. Here is a quick look at our agenda for today. We've got our welcome to the course, your distance learning cycle, essential core resources, connecting theory to practice, the safety-first mindset, and finally, check, review, and succeed.
All right, Section 1, welcome to the course, and really, setting the stakes. Now we have to acknowledge right up front that the work you'll be doing directly impacts human lives. The source material states it perfectly. An error at any point in this testing process can lead to severe immunological consequences, including immediate, complement-mediated intravascular hemolysis in a recipient. Basically, a single mix-up can be catastrophic. Mastering this material isn't just about passing a test. It is quite literally a matter of life and death.
Moving on to Section 2, your distance learning cycle, the pathway to mastery.
Since you're learning at a distance, you need a solid strategy to bridge all that academic theory with actual practical lab skills. So you're going to follow this 6-step cycle. First, explore the big picture topics. Then, learn the core principles. Third, connect that theory to reality. Fourth, apply to your lab techniques. Fifth, check your work through self-assessment. And finally, review any of your weak points. Explore, learn, connect, apply, check, review. That is your roadmap.
Section 3. Essential Core Resources, your laboratory arsenal.
Okay, so let's talk about the specific texts you'll be using for specific needs. Think of Rodak's Hematology as your theoretical foundation. That's where you'll get deep into physiology, cell development, and the latest WHO guidelines. Then you'll use Harmoning's Clinical Hematology to kind of bridge the gap. It has this incredible morphologic atlas and some really great clinical case studies. And finally, Dacey and Lewis Practical Hematology is your absolute authority. You'll go there for exact, step-by-step instructions on manual assays and for figuring out sources of analytical error.
Section 4, connecting theory to practice, manual foundations first.
You know, it's super tempting to just rely on modern technology, but you absolutely must master manual techniques first. Take a manual reticulocyte count, for example. Use a supervital dye like numethylene blue, and you sit there and count 1,000 red cells under a microscope. It sounds tedious, I know, but it builds these absolutely critical observational skills. You really need that fundamental, hands-on understanding of cell morphology before you can even begin to trust and troubleshoot a fancy automated platform like the Sysmex XN550. Because hey, when the machine inevitably flags an error, your manual foundation is exactly what saves the day.
Section 5. The Safety-First Mindset, Protocols and Quality.
When you're applying these skills, remember that the pre-analytical phase is where the vast majority of diagnostic errors actually happen. Strict adherence to WHO phlebotomy guidelines, that is non-negotiable. Your work has to align perfectly with global ISO 1589 standards, which means you're doing daily internal quality control on your reagents, like for ABO grouping. You also need to bridge historical terminology, like the old term do, with modern terms like weak D. That way, you can communicate flawlessly with every single generation of medical professionals in the lab.
Which brings us to Section 6, check, review, and succeed, assessing your progress.
Because you're in a distance learning setup, your integrity during self-assessment is literally everything. You'll have access to activity checklists and answer keys. Use them to honestly evaluate your understanding of the laboratory principles. It's really not just about checking a box to say you did it. It's about genuinely validating that you grasp these concepts before moving forward.
So be proactive here. Identify a personal supporter, like a senior colleague or a trainer, who can give you some guidance. Honestly rate your own knowledge from 1, being an expert, down to 4, meaning you have little to no knowledge. Take those end-of-module quizzes as soon as you finish learning the material. Develop realistic action plans, and rigorously revise any weak concepts before you even think about progressing to the next module.
I want to leave you with one final vital thought. Ask yourself this question at the very end of every single study session. Can you do your job better and ensure patient safety as a result of your work on this module? If your answer isn't a confident, resounding yes, then dive right back into your review phase, talk to your supporter, and keep striving for excellence. Because at the end of the day, your future patients are counting on you being at your absolute best. Are you ready to step up to the challenge? Let's get to work.